This workshop is on the Indian flower remedies and its practical application. That how can we use it into day-to-day life and day-to-day practice for the doctors, health practitioners, physiotherapists, and it will be used as a complementary to other therapies, so that it can be used by allopathic doctors, by a homeopath, by Ayurvedic doctors, by herbal medicine practitioner, by naturopaths, then by craniosacral therapists, CRT people, and physiotherapists also, and acupuncturists, those who are doing manipulation, for them also it will be helpful. So lot of people will be benefited, and it will be a complementary approach to their therapy. So it will add to what they are doing it with a very good, positive, favorable results. Apart from theory that how we make the flower remedies and then what will be the applications, and there are different groups of flower remedies, single flower remedy, and formulas are there, then the special flower remedies are there. So all this, how can it be used, will be explained. On the top of it, very important is something which is new research work which we have done. Okay, so that is, one is called as a neo-air therapy. Okay, laser therapy, how to use it and how practical it will be for people to do neo-air therapy. Okay, for a specialist like for the ozone people also, how it can be a complementary to ozone therapy also. So different type of therapies will be added to, which is down to earth, very practical, very easy to do it. It can be done in any environment, not necessarily it should be in operation theater only, not at all. In fact, it can be done anywhere as a OPD procedure, and that's all you will be learning it about and exchanging your ideas also. We are ready, we are open to any ideas or any problems you have, you find it difficult in your therapy. We may be able to give an answer to it which is down to earth and very practical. See, I am an allopathic doctor and I am MD radiologist, but I have seen lot of application as a complementary medicine in my allopathy practice also, and in other fields. So like Chinese medicine or traditional Chinese medicine, what it is called as, we can apply that also. In Ayurveda also it is very practical, but the best part is that you can use as a complementary, and it will help the other people to. As an allopathic doctor, I am greatly benefited because I have been able to successfully treat good number of cases, not 100% everything, but good percentage of success is there in treating my patients from cold to cancer or from age to arthritis. So like something very unique for a surgeon, how can I help? So then we have developed something called as a pre-surgical spray. So you spray around the body of the patient on a previous day. It will balance the aura in such a way that there will be a good success in surgery. The bleeding, chances of bleeding will be much less, and also the post-operative recovery is much faster. This spray is used as a pre and post-operative spray. So I'm just giving you example for, or say for example, ophthalmologist. If there is some retinal problem or something, or for ENT specialists in the deafness, this is going to be only physical approach, and it will be workshop only physical one, no online. And because there is a reason why it is, when there is a one-to-one interaction, people will definitely able to see it better and experience it. Exchange of thoughts will be there, and we are very open to any discussion, anything. We know there will be some limitations in flower remedies also, but we can definitely take help of other therapies at that time and add to whatever we are doing it. This is going to be on 1st and 2nd October 2022, and it is very near to our medical center, so people will be able to visit our medical center also in the evening, and we have an exchange of thoughts there and get together. In a way, people will be able to understand each other, because there are going to be a different therapies from homeopathy to Ayurveda to craniosacral therapist, orthopedic surgeon, eye surgeon, general surgeon. So all will be able to exchange their things with each other. Even general practitioner, for example, be it allopathic or homeopathic or Ayurvedic, it is going to help them a lot in their regular practice, day-to-day practice. That's what our aim is. We are not going to hold it to ourselves, but we want to teach other people so that they can practice these Indian flower remedies in their practice.